For more on this developing story, we are now joined by the Health Department's Acting Director General, Dr. Anban Pillay. Dr. Anban Pillay, less than 24 hours since we last spoke, and you said that there was no need to panic, and here we find ourselves as a country.
Yeah, so I think last night when we spoke, we didn't have a case, and as I think the Minister and the President confirmed, around midday today we had confirmation of the first positive test that came through, which now we've isolated, and we will trace all his or her contacts and isolate them as well.
Can you just quickly remind us and our viewers as well how this patient and how the medical staff were able to detect whether this patient has contracted the coronavirus?
So in my discussion with the patient's doctor, I understand that the doctor actually suspected that the patient may be infected with coronavirus, and it's actually the doctor who thought about doing a coronavirus test, and so that's how the sample was sent to the laboratory, and the NICD was able to then confirm that the patient was indeed infected. But the doctor also was very good in that she asked the patient to self-isolate from the time the patient had actually presented to her, and so the patient has been in self-isolation since then, which is a good thing, which means that it has limited the spread to other persons.
I see here from the statement that was released by the ministry as well that the test was done on the 3rd of March. Is that correct?
No, the sample was taken on the 3rd of March.
The sample was taken on the 3rd of March. And why was it that the department was able to confirm so quickly that indeed this is a positive, that the patient tested positive for the coronavirus?
Well, the test, as I understand from my colleagues who run the NICD and the lab, that it takes around 24 hours for them to confirm that it is definitely a positive test.
Okay.
And that's what, after receiving the sample, it took them about 24 hours to get that done.
Sure. And we understand that he was traveling with 10 other people, including his wife. How is his wife doing? Do we know whether she has tested positive, including the 2 children as well?
So we sent out a tracer team who will establish all of those facts. So they would take swabs from the family as well as other contacts that they may have been in contact with, and all of them will obviously be evaluated at the laboratory to understand whether any of them are also infected. And during that period, they would all be advised to remain in isolation, which means staying at home and not being in contact with any other person.
His wife, though, I'd imagine that the patient lives with his wife, lives with his 2 children as well. Where are they now?
The patient was in isolation at home. That's the information we had at the point at which we had a positive test. So the team has gone out to establish the details of the patient's health condition. The contact with the patient, the initial contact suggests that the patient was doing much better than he was when he initially went to the doctor. But I think we still need to manage the patient and his family to establish more details of the nature of the illness here. Okay,
I'm going to ask again, Dr. Pillay, where is the wife and the 2 children?
The gentleman, as I understand it, is living with his wife and children.
Sure, but where are they now?
At home.
So they are not quarantined?
No, they're quarantined at home, yes.
By who? Themselves?
Yes, so the doctor had advised them to remain in self-isolation until the tests come back. And so now that we've informed the patient that the test has come back positive, and the entire family will be in isolation, that there will be swabs taken to confirm whether the other family members have been infected, which will then mean we'd have to trace further individuals. That has been done now.
But why is this taking so long? If the test was done on the 3rd, or the positive feedback came back on the 3rd, why is it that at this point, 2 days later, we still don't know, as a matter of fact, whether the wife and the 2 children have been tested for the coronavirus and the results of that?
No, the person that went into the doctor's rooms is not the wife and children. It was the patient, the
Sure.
gentleman who's infected. His wife didn't go along, neither did the two children go along. So the doctor only asked for the test for the gentleman who was infected. So the sample went to the NHLS laboratories yesterday, and with a 24-hour cycle, the result only came out at about midday today. So now we need to understand whether the wife and children would be infected as well, because he obviously was remaining at home with his family.
So what happened after midday, after there was a confirmation? Did any health professionals or medical team go to the home of the patient?
Yeah, so as I'm saying to you that the NICD has an outbreak response team. That team made contact with the family to understand what their situation is, to advise them to isolate until we establish other medical details about them, to also understand their contacts and who those families are, to then isolate those families as well, and any other persons that they may have been in contact with, as well as the people that may have been in contact with outside of the home.
Okay, so the other concern, Dr. Pillay, is that by the 26th of February, we knew, as a matter of fact, that Italy was struggling with the outbreak, to such a point where Italy said that they are in a desperate situation, that within 72 hours from the first outbreak, almost a dozen towns in the wealthy regions of Lombardy as well as Veneto, with a total population of about 50,000 people, were placed under quarantine. And there was also concern that Italy is the worst hit European country. At least 11 people died after contracting the coronavirus, and there are almost more than 300 cases, most in the north. The 11th person to die was 76 years old. So we knew as far back as the 26th of February that Italy is struggling to contain the spread of the virus. Why is it that this patient was traveling from Italy on the 1st of March, when he came back, were allowed to be in contact with South Africans without being quarantined?
So the policy in place and the recommendation from the World Health Organization is that there should be no travel restrictions. Every traveler must be assessed based on their clinical presentation and assessment of screening at the airports, and if an individual is considered to be infected, the individual is then isolated within an isolated area in the airport and then moved into an environment where tests can be done, etc. This individual, when he came through the airport, was asymptomatic. Arrived in South Africa on the 1st of March, but only went to the doctor on the 3rd because of the clinical presentation, as I understand from the doctor, only became apparent around the 3rd of March.
Does this mean that we can't go against any protocols that the WHO comes up with?
No, that doesn't mean that. I think
then why
the point
didn't
I'm
we do
making
it,
to you
DG?
is that, well, the reason we didn't do it is because we didn't think it was appropriate to do that. Because if you're going to be quarantining everybody that comes from a country that may have a coronavirus outbreak, you basically will have very few people that would be traveling to South Africa and effectively have a travel ban. What you're suggesting is we put a travel ban in place.
Is that not the best way to try and contain the virus and prevent an outbreak?
Well, you can think about doing that. The US, for example, had a travel ban for the Chinese, and sorry?
No, you can go ahead, DG.
The US, for example, had a travel ban from China, but individuals from China then found different ways of traveling to the US. So this issue about a travel ban is not very effective, because the US then had 22 cases. So just introducing a travel ban, unless you want to say that South Africa doesn't allow any foreign person to enter the country. But then this individual is not a foreigner, he's actually a South African who went on holiday. So are you then going to say that South Africans don't go on holiday as well?
My question is more to say that how does the country prevent an outbreak of this disease, considering that you have a country like Italy, which has, some would argue, a very good health infrastructure in place, and our country is struggling with our health infrastructure. So how will we contain an outbreak of the coronavirus if we don't impose bans, travel bans, and take extra precautionary measures to ensure that there is no outbreak?
The protocol that has worked most effectively in all countries is to identify the individual early, have an effective laboratory system, which we have. The NICD is one of the best laboratories on the continent. When the individual is identified, to quickly move in and isolate the individual, identify their contacts, isolate their contacts, and prevent further contact between those suspected individuals and the rest of the community.
Okay.
That's the most appropriate approach. Using travel bans has not been a very effective mechanism to prevent disease from spreading.
Okay. Final question, DG. The aircraft that was supposed to leave for Wuhan, how far are we with regards to that?
Well, as I said to you last night, and you've asked me the same question again now, and I indicated to you on Sunday that the minister said that within 10 days an aircraft would leave and bring back those South Africans. And so we're on track with doing that.
Okay then, thank you so much. There you have it from the Acting Director General of the Department of Health, Dr. Anban Pillay.